for you to push for TeenTalk in Darien?
So I have to give more credit to everybody who was involved before I came here. I've only been here for a year and a half now, but I think that highlights kind of the importance that Darien placed on youth mental health. Before I got here, I think one of the most important things, as Dr. Adley mentioned, there was tremendous loss in this community. And we knew even before that our kids are struggling. When we look at the rates of anxiety and depression, they've steadily grown over the past 20 years. Prior to joining here, I was in clinical practice and I consulted with a lot of your schools, and we saw this consistently across the board, that there was this swell of need, and the swell of need didn't necessarily always match with the resources that were available. And what we know is one of the most protective things we can do for our kids is create a culture and climate of connection. Having one trusted adult impacts an individual so much from significant mental health issues. So it seemed such a logical fit of having a TeenTalk counselor who could support the work that's already being done. One of the things when I came here, the tremendous amount of community participation and the way the community rallied together around loss was tremendous, from the town and Allie to the high school, Ellen and Scott, to our Thriving Youth Survey, which really helped impact and inform kind of what we do to meet the needs of our kids. And wonderfully, the partnership with the Community Fund and Janet stepping up, it was really a collaborative effort to say that we need to support our kids. Not only their mental health, but their wellness. What are things that are doing to kind of build up those protective factors so that we have good, wonderful, well-adjusted kids, and realizing that sometimes there's a false dichotomy of academic achievement and mental health and well-being. And that those two things are actually synonymous. Like, you can't have one without the other. So I was just so grateful. The support from everybody in rallying together to support our kids has been tremendous. And I think that for any program to be successful, that collaboration, it takes a village, really comes to fruition when we can all come together and support our kids.
Thank you. And then the next, because we talked about partnership, we're going to have the third person in the group, Ms. Janet King, again, the Executive Director at the Community Fund of Darien. Why was it important to the Community Funds to expand TeenTalk to Middlesex Middle School?
I'm going to answer that with another question. How could we not? The TeenTalk program had been so successful. We had been funding their program in the Norwalk Public Schools. I don't have any experience being on a microphone like this. Their program had been so successful. We had funded it for years. We also had the statistics from the teen survey, which we had been taking it, I think it's since 2008, through, now we have a federal grant, the Drug-Free Communities Grant, which funds that. So everything pointed to getting this counselor at Middlesex. And while the Community Fund can take credit for raising the funds, it's really the individuals in our community that came forward with such enthusiasm. I'm very proud to say that I live in this community. I've been here for 21 years, and in 10 days, $30,000 was raised. It was unbelievable. I'd never seen anything like that. So really, it's to our local supporters that get that applause, that just felt this passion to help our kids. And it was our relationship with our schools, the Community Fund and our schools, that brought us to this point. So that's how it happened.
Well, congratulations and kudos to Darien for recognizing, right, that I think Dr. Dadd's words were that it takes a village, right, that together you saw a need, that it was already funded from the school board budget at the high school to say we need to expand this because, right, we talk a lot about it. The younger we can do this, help young people with their issues when they're little, you give them those coping skills so they may not go away. Family issues don't usually just go away. But you have a chance to give them those coping skills that they have them as they get bigger. So I'm going to encourage you and everyone else to continue finding those partnerships so we have it in every elementary, middle, and high school across the country. Okay, I'll stop. We'll start with Fairfield County.
Yes, and I will defer to Ashley too, if she has anything to add to this. But I will say, I think it's a wonderful balance when we look at that data that you talked about. A lot of the referrals are coming from our counselors, but a lot of the kids are also self-referring, which I think is huge. For whatever reason, they feel like, I mean, I know for what reason knowing Ashley, but that's a safe, warm place for them to go, and they readily seek out the help. I think that the feedback we've gotten from our psychologists and social workers is it's such a tremendous support. You never know when a kid's gonna have a crisis. And you already have a full day scheduled of counseling sessions, and you have to make up those sessions, and knowing that there is somebody on your team who can jump in, and Ashley has, whether she's needed at the high school in emergency. We had a staff related issue this year, and she picked up the phone and called Kids in Crisis, and we were able to support our kids across the district and our staff. So I think referrals come from many areas, and I think in general, the rest of the school mental health team just feels, I know at Middlesex, they cannot wait for Carla to come. They're excited to welcome her as part of the team. And I wanna highlight what, as a school-based clinician, I think sometimes there is that, what happens over the summer? What happens when it's the end of the day? Where do these kids go? And such peace of mind for our school-based staff to know that our kids will continue to be supported no matter the hour or what month of the year it is. So I think it's just a seamless and wonderful, wonderful part of what we can help support our kids with.
Thanks, Alycia. I think the 24/7 piece, we can't overstate it. We are available 24/7, and one of the things we hope you'll take on your way out is what we're really focusing on this year. We want to be everybody, kids, parents, agencies. We want to be your 3 a.m. friend. We want you to know that there's somebody to call at 3 a.m. So on your way out, you do need to grab, Ellen's holding one up, a 3 a.m. mug. It really is important for people to understand we are 24/7. And because of being in the schools, Darien High School, for example, is now 24/7. Because after hours, everything can come right over to Kids in Crisis. And the first thing we do next day is connect back with the high school. So it is truly a partnership. Our goal is to be that short-term crisis work and to partner with whomever.